We are continuing our series with behavioural therapist and addiction counsellor Susan Byrne, and this morning with Susan we're going to be talking about eating disorders. So Susan, we might first of all just start off with, when we say that someone might be struggling with an eating disorder, how is it categorised, or how do you know that that's what we're actually talking about?
Okay, good morning, Wendy. Well, eating disorders or disordered eating is actually a mental health condition with an intense preoccupation with weight. And what we do know is that eating disorders typically occur in adolescence or young adulthood, but not necessarily limited to these life stages. So an eating disorder can actually develop at any stage during somebody's life and normally triggered by a trauma. And what we also know is that they're potentially life-threatening, and it has been recorded that they have the highest mortality rate of any mental illness. And we also need to be mindful that eating disorders fall in under the behavioural addictions. So therefore we know that they're compulsive, meaning that somebody feels that they have to continue in that behaviour, and that they're also impulsive. So they can't stop, and there's no interventions that they're able to put in place.
Is it a case of the behaviours itself around the eating disorder are kind of like addictions in a way?
Absolutely, yeah. And when we look at something like anorexia nervosa, which is the most well-known eating disorder, if somebody presents with that, but generally they have a view of themselves as being overweight, even though they're dangerously underweight, and they will avoid eating certain types of foods, counting calories, food restrictions, very restrictive on eating patterns, and a very distorted body image, including the denial of being seriously underweight. If we looked at something like Bulimia Nervosa, which is probably the second most well-known eating disorder, people with bulimia will frequently eat unusually large amounts of food in one specific frame time. And that episode usually will continue until the person becomes painfully full. Like there's an actual pain in their stomach where they can't eat anymore, even though they will continue to keep eating even though they're in pain. And that's the compulsive piece of the addiction, Wendy. And generally the binges will happen with the type of food that they've normally been trying to avoid. And what's interesting with anorexia nervosa and bulimia nervosa is that we will see purging patterns of behaviour, and purging behaviours such as vomiting, induced vomiting, using laxatives, excessive exercise, and fasting. And a third eating disorder we have is binge eating disorder, where generally there's no purging, but it is exactly what it says it is. It's binge eating. Again, eating large amounts of food very, very quickly, normally in secret, until uncomfortably full and in pain, and despite not having that feeling of hunger, and a feeling of complete lack of control. What's interesting with the binge eating disorder, you generally won't find a purging behaviour. And we have a fourth eating disorder, which has just come up in recent years, called Orthorexia Nervosa. And Orthorexia Nervosa is an unhealthy focus on eating only healthy, clean foods. So you'll see the same kind of pattern in the behaviour, where you have the compulsivity and the impulsivity, but it's towards healthy, clean foods only.
Susan, so many things we have talked about, various different addictions. The starting point is often the person themselves recognising that there is an issue. Is it the case with many of these eating disorders that you've touched on that it's a long time before the person actually realises, I do have a problem here? It can be, Wendy, but I would always say the earlier you catch this, the higher the efficacy of the treatment and the interventions. But when we look at some of the backgrounds of why an eating disorder develops, and as I've said earlier, it can develop at any stage in your life. If we look at biological or a genetic factor, if you have a family member or a close relative with an eating disorder or an addiction in the chemical or the behavioural addictions, you are at a higher propensity of developing something along the eating disorder lines. If you look at psychological or behavioural backgrounds, we know that certain personality traits are present in eating disorders, such as perfectionism, impulsivity, which I mentioned earlier on, neuroticism, a history of anxiety, but that overall dissatisfaction with your body image. It's poor self-esteem and generally overall very poor confidence. And then when we look at social or cultural factors, basic things like being teased or bullied about your weight in school, peer pressure, social media, experience a trauma
will increase the likelihood of developing a disordered eating belief or pattern, you know.
And so what happens, let's say there's a situation, Susan, and I know you're saying it can impact anybody at any point in your life, but what if there's, let's say, a parent who has noticed, one of their children, a change in their behaviour and what they're eating, all the things that you've touched on, what are the next steps for them to try and help their child?
Well, like I said before, Wendy, open the lines of communication and start a conversation. And I would talk, first of all, I'd talk to a GP. There's a fabulous website called Bodywhys. It's BODYWHYS. Fantastic information on eating disorders and the next port of call if you're presenting with the certain signs and symptoms. I would say that the right type of therapy with a counsellor or psychotherapy, and I'm stressing that, the right type of therapist needs to be trained in eating disorders. I would always say talk to a nutritionist or a dietitian to help with regular meal plans, weight management, keeping an eye on BMI. There are times when medication is necessary, but that's only to stabilise. And what we would often see with eating disorders, they don't present on their own. An eating disorder is a psychological problem, and that will always present with other psychological issues such as OCD and sometimes personality disorder, depression, anxiety, self-harming will be a big one, intrusive thoughts.
And yeah, but as you say, Susan, there's always other root causes. It's not just as simple as, wanting to look thinner. And, that's a very superficial way of looking at it. What about recovery? I mean, you mentioned there, obviously, like a lot of addictions, the earlier the intervention, the better chance of a proper recovery. But what does it look like, and is it possible?
Recovery is always possible, Wendy, but I always say to my clients, there is no cure for an eating disorder. An eating disorder is managed for the rest of your life. But there are some really good interventions like cognitive behavioural therapy, which challenges the negative thoughts and beliefs that somebody holds about their body image, or control issues, or the intrusive thoughts. You've got dialectical behavioural therapy, which is also a very good intervention with eating disorders. You've got motivational interviewing. There's a lot of modalities that are well researched, that have very high efficacy rate, but the important piece is to find a therapist who's trained in working with people with eating disorders.
Yeah, and seeking out the help. Susan, as always, thanks so much for your advice this morning. That's Susan Byrne from the Connolly Counselling Centre. And one of the things that Susan mentioned was the website Bodywhys. So that's why, Bodywhys, BODYWHYS.ie, a good source of information in relation to eating disorders.